and welcome everybody in today's webinar on sleep hygiene. As Isha has already set the context, let's try to understand what is sleep hygiene and let's go through first the agenda of today's session. So, firstly, we'll try to understand what the word sleep hygiene mean with one case study which we all could easily relate to. And once we are able to relate to a case study, it will be more easy to understand what are the impacts of not practicing sleep hygiene and what are the benefits once we start practicing sleep hygiene on a regular basis. Then, once we understand what is the importance, now I'm motivated enough to change it. So, first thing I need to do is set goals, how I'm going to achieve it. So, we'll talk about the strategy to setting goals for achieving sleep hygiene. And next step is when I have already set goals and start achieving them, the next thing I will be needing is how I'm going to maintain sleep hygiene. Right? So, all of these things we are going to cover in today's session. Of course, we will be talking about some practical solutions, some strategy, some cognitive behavioral strategy to bring the change in context of practicing good sleep and also how to maintain the change. So, we will be talking about all of these things. So first, let's start with understanding the term sleep hygiene. What is sleep hygiene, right? So this is not a very common term. We all don't use it in our routine life. So basically, sleep hygiene is cumulatively all those good habits which improve our sleep quality, the habits which we follow before we are going to bed. So it can involve not having a lot of caffeine during the daytime, not having caffeine or alcohol based beverages just before going to bed, eating our last meal at least 2 hours before to bed, then sleeping between 9:30 p.m. to 7:30 a.m. in that duration. That gives a maximum benefit to our body and mind when we sleep during these hours or in duration of these hours. Also, it involves not involving into very mind engaging activities before we go to bed. So that covers very interactive or social media time or just scrolling social media when our mind get engaged into binge watching series, movies, or some sort of shows on your TV or your phone or any sort of a screen. All of these things keep us mentally engaged. So when we are mentally engaged, sleep goes little bit away, away, and away. Right? So cumulatively, not doing all of these things, consider as a healthy sleep ritual. So these are the things help us to fall asleep more easily and have more satisfactory sleep. And by improving these sleep hygiene or good sleep rituals or following more good sleep rituals, it boosts our physical and mental health. And when we have a good physical mental health, of course, it reflects on our performance during the daytime in our personal areas, in our professional areas, and so on. So, to understand it better, where we stand right now when it comes to sleep hygiene, we have this one example, one case study of one of my patient. Of course, we have changed the name of the patient. So here her name is Seema. She's a 35-year-old marketing executive and mother of two. So you can see how full her plate is. Her day starts at 5:30, 5 o'clock in the morning, where she has to wake up and wake her kids up, getting ready them for their school, packing their tiffins, supervising their process of getting ready, and then she herself has to get ready, send their kids to school, preparing for the office and everything. When she reaches to office, she has to mentally and cognitively very alert because her job is demanding in such a way where she has to practice a lot of her cognitive skills. There has to be creative problem solving. There has to be a lot of other cognitive skills. She has to use her memory. She has to use a lot of her cognitive skills, which for that, to stay a little bit ahead of all of these things, she has to take a lot of cups of coffee. So to think little sharp, to think on her feet all the time. So she needs to have a lot of cups of coffee to get through her day work-wise. When she reaches home, she's already tired. Now her emotional responsibility towards her kids drains her out a little bit more. And now she is going to sleep. So before sleep, to just feel free, just feel relaxed, what she does, she indulge into interest activities. So that is only me time she can have. And somehow we all are in a habit not to put our sleep first, or not to consider sleep also as a healthy me time. She delays her sleep time and indulge into only one me time activity she knows, or interest activity she knows, which is easily available, is screen time. So she'll scroll her social media. She would binge watch something on her phone or on her TV, so that start keeping her awake and disturbing her sleeping time. So it gets delay every single day, delay and delay, because sleep is not her priority right now, but her wake up time is same. So no matter how late she has slept, n number of because of n number of reasons, she has to wake up 5:30 in the morning, since she has a lot of other responsibilities to go on with the day. So, because of this kind of ritual she used to follow, now it has started taking toll on her overall well being. Her poor sleep has started affecting her physical health, her emotional health, her mental health, right? How and what are the factors, or what are the effects were there on her well being? So, there were physical factors. Because she's tired all the time, she has not taken a good amount of sleep, a healthy, satisfactory sleep. And because there is lack of exercise, there is excessive caffeine intake. And because of that caffeine intake, not going to bed on a right time, not having adequate amount of sleep, her circadian rhythm has got disrupted. There are environmental factors also involved, because she now got into a habit of falling asleep while TV is on. So there is no noise control, there is light all the time, the room environment is not comfortable. Now, also, it is part of her habit. So, what is her habit? Irregular sleep schedule is her habit, and engaging involving into very mind engaging, very stimulating activities before her bed is one of her habit. It has become her habit. So she sleeps late. Anytime, one day she's trying to sleep at 11 o'clock, the other day she's trying to sleep at 1:30. So it's not fixed, and this has become her habit. And now all of these things together started affecting her mental health. So because one day she sleeps at 2:30, the other day she's trying to sleep at 11:30, she's unable to fall asleep. So that involves overthinking. Now she has started overthinking whatever happened during the daytime. And remember, the good sleep is always helping you to de-stress yourself. So when you are taking very good amount of sleep, a quality of sleep, your body orders your mind to release the stress. But here, since she's not taking that quality sleep, her stress is high all the time. Even when she's trying to fall asleep and she is unable to fall asleep, it increases her stress. It increases overthinking. And anxiety is the next stop to come. And overall, the emotional disturbance has started happening with her. So during the daytime, because of all of these factors, lack of sleep, she has started feeling it was very challenging. It is very challenging for her during the daytime, keep her focus on while she's working in her office, finding those solution which she used to find solution or resolve the situation very quickly. Now everything has become very difficult for her. And to stay focused, she is relying on more and more caffeine, which is putting her sleep away, away, and away. So this is the story of Seema, one person where we can relate to her life very easily, how we are practicing our life, how we are understanding sleep hygiene, and how we are practicing our sleep hygiene. Let's try to take a quick poll to understand where we stand right now in comparison of or in relation of Seema. So here is the poll, everybody. Okay, as we can see in this poll, that almost 83% of you agree with how Seema is feeling or how Seema is practicing her life. So that is pretty high. That means just like Seema, we need to start working towards it to correct our sleep in order to get better mental and physical health. Okay. So if someone asked me to change something about my life or change one of my habit, which I have been following for a while, I need to understand what are the benefits, how I'm going to be able to correct my sleep and why I should correct my sleep. What is the reason? What it will help me to gain? So, what are the benefits of correcting sleep, or what are the benefits of following sleep hygiene better? So, of course, there are a lot of benefits regarding our physical health. So, when I have slept well, my energy levels go up. It increases lot of my physical health functions. So a lot of my bodily functions. It works on my immune system. My all bodily functions are well. It reflects on my immune system, and at the same time, this kind of a healthy lifestyle habit following reduces the risk of chronic health issues like blood pressure, like heart cardiac issues, like high diabetes. All of these are the lifestyle related disorders related are lung disorders, lifestyle disorders related to our liver. So if I'm taking good amount of sleep, very satisfactory quality sleep, it works on my all the physical health areas, right? It has psychological benefits too. Once I work on my sleep, my mood starts getting enhanced, my emotional abilities are there, I feel more stable. Of course, it reduces my stress. If my stress is low, it will not trigger the anxiety. And overall, my emotional well-being increases or gets better and better if I'm taking good amount of sleep or practicing all the good sleep hygiene habits. And when I'm physically more fit, I'm psychologically or emotionally more fit, it also reflects on my professional health, on my social health. My mood is good. It reflects on my social health a lot. I'm more available. I enjoy the social gathering more. I enjoy all the social things going around. Interactions become more interesting because overall I'm feeling good. My health is good. My physical health is good. My mental health is good. And when my physical and mental health is good, I perform well at my workplace also. So it increases the quotient of my cognitive health. So the cognitive health, which is related to my professional and my personal performances, it increases. Right. So these are all my benefits and focusing these four areas: physical, mental health, social health, professional health. All of these get this increases. And when all of these things increases, that means I get into a little bit more, I start feeling a little bit more motivated towards changing the habit. So to understand how much you people are interested in it and how much we can do more, we have a quick poll here. Isha, can we have the poll? Okay, so as the poll suggests, there are almost 67% of people who are unable to sleep or who get a disturbed sleep because of stress or anxiety, right? So when we are unable to sleep, it reflects badly on our emotional health, as we have already discussed. And there are few people who do not feel this often, but sometimes it does happen. So it needs to be addressed. Okay. So to understand it better, let's move forward with the now, since we have anxiety issues because of sleep, we know what are the benefits of practicing good sleep hygiene. Let's move towards how to set goals, how to start working directly or immediately on the sleep hygiene matter. So making certain kind of goals and goals which supposed to be by nature achievable, they keeps our motivation up. So I need a strategy to set goals in such a way which keeps me going. Once I achieve goal, I need to maintain it also. So here is the quick strategy to set goals which will keep your motivation up and make you do more and more towards achieving your goals. So how we can do that in context of sleep, right? So first thing about these goals, they should be set in such a smart way. So we call it a smart goal setting. The goals which are specific, measurable, achievable, relevant, and time bound. By nature or in fashion of this kind of goal setting has a higher tendency or higher ratio to achieve more frequently. Okay, so let's understand how we can set these smart goals in context of sleep hygiene. So, for example, I have a habit of excessive screen time before I go to bed, which is not a sleep hygiene practice. It is opposite of that. So, in order to achieve that sleep hygiene habit of reducing the screen time or eliminating the screen time in a run, I will start with smart goal setting. So the goal is very specific that I want to reduce my screen time before I go to bed. That's my specific goal. So that is the specific part of smart goal setting. Then the goal should be measurable, visually measurable also. So we can keep a track of it or how we are changing it and how much we are changing it. So it should be measurable. How it is going to be measurable? For example, I have a habit of having a 1 hour screen time before I go to bed. So I want to reduce it by 25%. So that is a measurable part of goal setting. So in 1 hour, if I am reducing 25%, which is just 15 minutes, right? And since it's a minor change, our mind accepts slow changes. So the smaller changes are by nature to be more acceptable by our mind. So it is very important to we make achievable goals. Okay. So 15-minute ka change is a achievable goal and we will be able to achieve it if we follow it for 10 days or something. But it is achievable if I have to bring only in by 15 minutes. Okay. And then it is also relevant. It is relevant to overall improving my physical health. And these goals are time bound. How long I'm going to maintain this goal or how long I'm going to do. There has to be some sort of a time deadline or some sort of a time that I will be bring this change for 15 minutes after 15 sorry I will be bring this 10-15 minutes ka change before going to bed for 10 days. After 10 days following it consistently, it will become more easy for us. And since it is going to be become easy for us after 10 days, we can extend our goal. So now I will reduce it again more 25%. So which will become 30 minutes before we go to bed. So now my screen time used to be 1 hour. Now it's just 30 minutes. Okay. So you can set any of your health goals in a smart way. So it will make you feel more motivated and we can achieve it better. Okay. Now, I have given you the strategy how to set goals. Now, I want to discuss with you the tools to achieve these goals, right? So, these tools are lifestyle change, environmental adjustment, and behavioral techniques. So, the reducing the screen time is sort of a lifestyle change and also can be part of environmental adjustment. So we can reduce the screen time, we can reduce the caffeine intake, we can start engaging into relaxation activities more rather than mind engaging activities before. So all of these things are lifestyle changes as a tool to bring the good quality sleep to us, or practicing more sleep hygiene. Also environmental factor, because the environmental, some of the environmental factors are very controllable. Controlling the temperature of my room, controlling the light, using that white noise machine, all of these things are controllable factors. If we adjust these environmental factors, it will help us to achieve our goals, right? Then next is behavioral techniques, right? Why we need behavioral techniques? So as in a poll, you people have said that many of you feel that you are unable to fall asleep due to anxiety or stress. So when the anxiety and stress is involved, we need behavioral techniques. So behavioral techniques like practicing mindfulness, relaxation exercises, set more consistent wake up and sleep time. Because sometimes what happens, a lot of people have certain kind of jobs where they could sleep late and they could wake up late also. So setting up this wake up time and sleep time with the help of behavioral techniques will help you to achieve your health goals. At the same time, it will work on your stress levels, it will work on your anxiety levels, right? So it is extremely important when to add more behavioral techniques with the help of expert, which will understand how your sleep is disturbed because of psychological factors like depression, anxiety, high stress levels, the habit of overthinking. So in all of these areas, we need help of expert to add suitable to you only kind of behavioral techniques, because one behavioral technique which is very useful for you not necessarily can work for me. So every individual is different when it comes to emotional health. So anxiety, depression, overthinking, high stress levels, one stress level technique which is useful for you cannot be useful for your friend. So everybody is different and they need to have a specific tailored behavioral techniques or cognitive behavioral techniques to increase their health caution level, right? So what kind of behavioral techniques we are talking about? This is just two examples which we provide to our patients when they have sleep issues. So, five finger breathing is one of the tool which we give when people have high anxiety issues or very much overthinking issues. So, while trying to go to bed, there are people who have decreased their screen time, who are following the healthy sleep ritual, almost everything, but still, because of the high level of stress or anxiety or overthinking, they are unable to fall asleep. So in those cases, we give them certain kind of breathing exercise, mindful breathing exercise, lot of thought record sheets where they can look into it, where they are going wrong, and what are the strategies which we can offer to our patients, which they can implement and get out of for themselves, where they have hard time falling asleep easily, even after having a very hectic day. Okay, so these are few examples of this kind of a mindful breathing practices which can be used as a cognitive behavior therapy tool. Okay, now we'll talk about maintaining sleep hygiene, right? So once, for example, you have achieved your sleep goal, right? So now your habit is changed and you have started going to bed by 10:30 and your screen time is nil, zero before going to bed. You are not taking caffeine, you are not involving into mind engaging activities and everything. You have achieved your goal and now you're sleeping well. You are practicing all the sleep hygiene parameters, but consistency is the key, and preparing yourself in advance for all of those setbacks or the hurdles we are going to have in future, that is extremely important for us. So there will be weekends when we used to go out and stay up late and do all of those things which we usually don't do and which are not in favor of sleep hygiene practices. So for that, we can plan ahead. So we are not asking you not to have weekend relaxation, or not to have any parties, or not to go out over a weekend. Of course, these all things are part of life. These things are important part of social life, and we work really hard during the week time. So over a weekend, we try to relax using all of these activities, right? But what we can do is we can always limit them. So if I'm sleeping by 10:30 weekdays, I can stay awake till 12 o'clock during the weekend, and also limit the other activities during the daytime, which already we are not doing over a weekend, which we do during the weekdays. So that also can be, that time also can be used in all the socialization and everything. But whenever you go for certain kind of practices or habits which are not in favor of good sleep hygiene, you can limit its time, and you can always plan ahead, right? And create your own support system, which will remind you, people around you, your own habits, your own cognitive neuropathways will become your own support system. That this is my health goal, I have to achieve it, and all of these factors are play as a support system in my lifestyle. So, so far we have covered that what is sleep hygiene, what are the benefits of sleep hygiene, how we can set achievable goals or smart goals for that, and how we are, what are the tools and what are the skills which will help us to achieve good sleep hygiene, and how we will be maintain it for a long run. So, how willing you are, or how what are the other challenges to understand it? We have a quick poll here, which will give us an idea. Isha, can we have the poll? Okay. So the poll says that almost 56% of you have a difficulty in limiting the screen time before going to bed. And 22% have a problem maintaining or consistently the sleep hygiene. And few of you have a problem with the anxiety, which is holding you back from achieving your sleep hygiene practices, right? So this give us a bit idea that we can start working. All of you, I have given you the strategy with the example how to set achievable goals, how to set smart goals. So you can start with that. So this poll was to give you also a better idea from where you need to start in context of practicing good sleep hygiene. So start with the limiting. People who have a excessive screen time ka problem, they can start with limiting the screen time. People who have a problem with anxiety, they can start getting help for that, where you can get help to learn more cognitive behavior therapy tools to address your sleep problem. And people who have a maintaining the sleep hygiene problem, they can start working, planning ahead. When you have a problem maintaining, is it over a weekend, is it over a particular time, there are particular reason for it, so we can prepare in advance for certain kind of situation, how we are going to deal with it, right? So this is how we are going to address the sleep hygiene issue. Quality sleep is vital for overall well-being, right? And how to address it, identify what are the things which are holding us back from addressing the sleep disturbance. That is the key. So far we have talked about it. How we can maintain a consistent pattern, that is also something we have discussed about. That planning ahead and being more prepared for it, that's the key. We have a lot of relaxation and mindfulness practices which helps to achieve your sleep goals better and better. They are the perfect fit to achieve more sleep hygiene habits in routine, implement it and consistently follow it. So they are good habits, good sleep rituals, adding mindfulness or relaxation techniques before we go to bed, right? And of course, we can work towards the environment around us, which could be helping us to achieve better sleep. I would ask you all to practice more and more of these habits which are in favor to make your sleep a quality sleep, because in with the quality sleep our body, our metabolism, everything increases. It will help you to achieve your health goals also. If you are taking a good quality sleep during 9:30 p.m., between 9:30 p.m. to 7:30 a.m., it will help you to lose weight. It will help you to reduce your stress. It will help you to reduce anxiety if you have. It will help you to gain maximum physical health you is possible. So sleep is a huge part of actually a tool or a skill to have to maintain good physical mental health. So far, all of these things what we have discussed, and we have provided you with the practical solution which you can implement to your routine life, right? So, Isha, can we move towards if anybody has any questions or something they want to discuss?
Yes. First of all, thank you so much, Dr. Himval, for a really insightful session. Before we wrap up the session, we'll have a quick 10 minutes Q&A where you can ask Dr. Pandya any question about sleep hygiene, sleep disorders, or anything else related to today's topic. Don't miss this opportunity to get an expert insights. And while you guys are preparing your questions, I would like to share some exciting offers from MyTatva, the platform hosting today's event. In many of our programs, we offer wellness services alongside diet and exercise with a strong focus on improving sleep patterns, managing stress, boosting motivation, and enhancing emotional regulation. By addressing these key areas, we aim to help you achieve a balanced and healthy lifestyle. We are offering two offers: 10% off on lifestyle management program, a personalized plan to help you develop healthy sleep habits. Use the coupon code MyTatva10. I'll drop the payment link in the chat for your easy reference. Or you can also book a free consultation. Yes, guys, a free consultation with one of our health experts to get personalized advice for your sleep concerns. Whosoever wants a free consultation, please drop a yes in the chat. Also, you can redeem these offers by visiting our app or through the link provided in the chat. You guys can redeem this offers by visiting our app or through the link provided in the chat. Please drop your questions if you have any. So we have one question: how to overcome sleep apnea?
So, sleep apnea is basically a medical condition. So, first of all, for sleep apnea, you need to visit your doctor. Doctor will advise you some sort of a machine or something which will help you to breathe little bit better, because sometimes sleep apnea can increase your anxiety levels also. And because of sleep apnea, there is a lot of sleeplessness. So for that, what we need to do is consult with the doctor. If required any medication by the doctor, we need to understand what are the levels of sleep apnea and how to address it. If there is a pharmacological intervention is required, that we need to first. And with that, in addition to that, we can support you with a lot of cognitive strategies which will help you to sleep and relax a little bit more. So how we can be able to support you that correcting your daily sleep patterns with also in addition to pharmacological intervention.
Thank you, Dr. Himwal. Any more questions, guys? Okay, guys, with this, we are ending this session. Thank you all once again for attending to this webinar. We hope it was both informative and inspiring. Remember, good sleep is crucial for your health, and we are here to support you in improving your sleep habits. Have a great day ahead, and don't forget to prioritize your sleep hygiene tonight. Thank you for joining today, and I encourage you to take the first step towards better sleep hygiene.
Thank you, everybody.